remote learning.
Thank you so much. Now, can I invite Terry, Professor Terry?
Hello, everyone. So I am Terry. When Emma flashed up her Slido and we had to self-identify, I actually realised that I tick quite a lot of the boxes because I'm an NHS clinician and I'm academic. I am a carer for someone living with dementia, but it's for none of those reasons that I'm on stage today. I'm on stage today because I have the pleasure and the honour of chairing two of the groups that are helping put on the conference today, and that is the SDRC and the Brain Health Arc. So I'm going to talk about both of them. Hopefully I won't get the bell. Let's see if I can do it in time. So let's start with back in the room. Let's start with SDRC. So the SDRC was formed because there was a recognition that Scotland does dementia research really well. But it was doing dementia research really well in little pockets. So there was pockets of excellence, you know, here in Dundee, in Aberdeen, in Edinburgh, in Glasgow, but they weren't really working together. And it was also true that a number of the stakeholders who help make dementia research happen, and by that I'm talking about academics, but also people living with dementia, also people working in the third sector, also people working in the NHS, hadn't really came together to realise the potential of joint working. So SDRC, the vision was to create a safe space that would bring all of these people together. And there's a picture there from the first SDRC meeting when we were very proud to have 100 members. Fast forward 10 years, we are now at more than 1,000 members. And I think it's real testament to how the community has came together that even for this meeting, we were sweating because we were worried we were going to have too many people in the room. So we really have grown. Where am I clicking? There. So each year, Carleen, who's sitting at the side, has a look at what the SDRC members have been doing. And we compile a report that goes online. I've had a sneak preview of this year's report. And it was a smorgasbord of things that I could take. And I've just got a few highlights here. Just have a look at this. Have a look at our papers. Have a look at our grant funding, but particularly have a look at our collaborations. You know, if you're to ask me one thing that Scotland does really well in dementia research, we're able to collaborate with other people. We do stuff well here, but we do stuff really well when we work with other people. And, you know, within SDRC, we realised that dementia research comes in lots of different flavours. We divide ourselves up into these themes that you can see here in this graph, just showing how grant funding goes along with themes. So we have themes around diagnosis. We have themes around, you know, fundamental lab science. There are themes around living with dementia, prevention, informatics. But dementia research is moving really quickly. And a discussion that we've been having within the SDRC is whether these themes are even really the right themes now. So, you know, if you have thoughts on maybe other themes that should be part of SDRC, do please let us know. The other thing that's been really good to see is we survived the pandemic. I think we're all trying to repress memories of COVID now, but let's just take our mind back a couple of years. Things were pretty tough, and they were particularly tough in dementia research. And you can see in the graphs here how grant funding, publications really nosedived over the pandemic. But, you know, through communities like SDRC, we've helped to rally things, and we're back on track in terms of producing papers and in terms of winning grant funding. So what do we actually do in SDRC? Well, we do loads of stuff, so I've just highlighted a few things here. We try and keep our ear to the ground, and we create a newsletter that tells you about things that are happening in the Scottish dementia space. We also really do try to create a sense of community, so we have blogs from our members. I think some of the best stuff on the SDRC website is actually some of the blogs that we have, some really quite powerful blogs from people who are working in the dementia space. We offer prizes. One of the things that we've always wanted to do in SDRC is support people who are earlier in their research journey. So you will find that we have lots of prizes today, and throughout the year, SDRC offer lots of prizes just to give people that extra bullet point on their CV that they maybe need. And of course, we run meetings. That's why we're all here today. But as well as these big meetings, we run smaller special interest group meetings themed around some of our particular interests. So if you want to know more, go to our website. If you're not a member of SDRC, why not? It's free. We don't spam you with the newsletter, but it does just help keep you connected. So that's SDRC. Very proud of SDRC. But as some of you may have heard me talk before, as I looked at what SDRC was doing, I did start to have a bit of an existential crisis because it wasn't enough for me. I was very proud of it, don't get me wrong. But I felt we needed something to go alongside SDRC. And the reasons were, if we just think about the name, we say we were Scottish, but were we really reaching all of Scotland? If you think of some of the work that Tom and the team have been doing, getting out into the islands, I felt SDRC hadn't quite achieved that just yet. We have the D word in our title, but actually we can be kind of constrained by that because the research that I think is important is about more than just dementia. It's about the whole brain health space across the life course. SDRC has a research focus, which it absolutely should have, but research can't exist in isolation. You also need people to be looking at policy and training and innovation, and SDRC didn't have that remit. So I felt there had to be something else. We had a consortium for dementia research, but I think we needed another thing, and that was the genesis of this other consortium that I chair, which is the Scottish Funding Council Brain Health ARC. We've got a little mission statement there in italics at the bottom, but basically Brain Health ARC exists to complement SDRC, taking a broader remit around all aspects of brain health, not just dementia, and taking a broader remit than just research. So what do the ARC do? Well, I think one of the important things that we want to do is we want to develop dementia research in Scotland. We're already great, but we could be even better. And so we have lots of activities and resources to take people on that journey from, wanting to be a researcher through to starting to develop an idea, through to starting to build a team, through to applying to a grant. And then when the research is finished, actually having some impact from that research. And at all of those stages of the journey, there are different things that the ARC can do to try and help people along. So that's all kind of good in theory. What do we actually do? Well, here's just a couple of highlights of things that we've been doing in the last couple of months. We've been trying to shape policy. Believe it or not, there's an election happening. You can't have realised that because it's not been in the news at all. But we have been in Holyrood, virtually in Westminster. I haven't been there in person. And we've been, making sure that brain health and dementia research is something that ministers are aware of and are talking about. We mentioned already that SDRC has a remit around giving prizes, as does the Brain Health ARC, again, to support early career researchers. We want to give training. We surveyed early career researchers about topics that they wanted to know more about, and we put on a webinar series specifically on those topics where early career researchers felt that they needed a little bit more. And we're creating collaborations. We're creating collaborations within Scotland, but we're also creating collaborations beyond Scotland, and we've just created quite an exciting collaboration with the Rhineland region of Germany. So watch this space for more on that. And in everything that we do, we've tried to do things just a little bit differently. So I'm going to just finish with 3 examples of how SDRC are doing things a little bit differently, and it's up to you to decide whether we're doing them well or not, but we are certainly doing them differently. So the first thing is around meetings. So usually at a conference, you'd get people and they would tell you about science and it would be fascinating, and that's great, and we need those kinds of meetings. In the ARC, we're running a slightly different kind of meeting. So what we do is we liaise with funders, we find out about big research calls that are on the horizon, and then we have meetings that are themed around those calls so that Scotland is primed and absolutely ready for when the multi-million-pound research calls come out. So we've already had meetings on biomarkers for dementia and on lifestyle interventions for dementia. And we've got another meeting coming up later in the year about medical technology and quantum technology. We also try and support not just in kind, but through financial support, because we realise how important that is. Now, I have to manage the expectation. Within the ARC, we don't have lots and lots of money. I wish we did, but we don't. But the money we do have, we try and use strategically. So we have a seed funding call for those small amounts of money that you maybe need to move from an idea to actually being able to put words on an application form and apply for something more substantial. In addition to that, in partnership with the R.S. McDonald Trust and the Chief Scientist Office, coordinated through Frank Gunn-Moore, who's in the room, we've created a larger funding call for grants at around the 20k mark to support pilot work, again, with a view to working towards those really big, substantial grants. And Susie mentioned that tomorrow we're going to be asking some of you to do some work around designing research questions, because we've been asked by the NIHR, one of the big research funding bodies in the UK, to create research questions, and those are questions that will then be commissioned calls for people to respond to and actually do the work. And then the last thing I want to talk about is data. So data is something that everyone's talking about nowadays. What tends to happen with data in academia in general is someone gets hold of a data set and they treat it like the precious in Lord of the Rings. They hoard it, they don't let anyone see it. But that's not what we're all about, and that's not what the ARC is all about. So we were very fortunate to be given a data set with some state-of-the-art information on new biomarkers, and we decided we would open it up to the whole of Scotland. So we did a lot of the heavy lifting so that people can have access to that data without having to fill in lots of forms, without having to have access to specialist software, without even necessarily having to have a background in informatics. We provide lots of support so that people can come to our data set with questions about dementia, and we will help people to answer those questions. Are we doing well? Well, that's for other people to decide. But if I may, what I would just point out is that in a special edition of the Scientific American that was themed around brain health, there was a whole chapter on Scotland. There was not a chapter on any other country in the world, just Scotland. California got a mention. So if any of that is of interest, and I hope it is, then do please connect with us. And you can connect with us in lots of ways. We have our website, which I would encourage you to go to find out about what we do. We have a mailing list, similar to the SDRC. We won't spam you, but we will just keep you up to date with what's happening. The platform previously known as Twitter, we have a handle there, and we're on LinkedIn. So please do join us. And with that, I'm now going to hand back to Emma. Thank you.
Okay, thank you. I'm not going to summarise because in interest of time, we've only got a half hour now to go